Good evening. I am Dr. Kuldeep Jain, Director IVF Center and Laparoscopy Center, Delhi. Today I am going to speak on a subject which is actually not talked about very frequently, and this is the problem which is available, which is actually faced by all people globally. The problem of infertility and IVF is going to be discussed in today's session. What I am going to discuss today is not only IVF, but all problems related to your treatment, whether it is infertility, whether it is female infertility or male infertility, and all advances which are actually taking place in the field. All these advances, they can help you in getting the parenthood as far as your treatment is concerned. My talk is basically based on a lot of questions which I keep on getting from patients all over the globe. So I am not going to tell you how in vitro fertilization, or in other words, it is called test tube baby, is done, or any other thing which is not related to you. But I am going to be speaking on all the questions which are always in your mind. As far as the infertility is concerned, the main question which comes to you, comes in your mind is what is the best treatment for me? And when somebody tells you that you will require in vitro fertilization or IVF, it always strikes to you in your mind that why should I go for in vitro fertilization? Why not any simple treatment? I am so young. I am just married 2 years back. So why your doctor is telling you to go for in vitro fertilization? Now, in vitro fertilization is a process where your wife's egg are removed from the body by a technique which is called ovum pickup. It is removed by ultrasound, and once the egg are removed from the body, your sperm or husband's sperm is mixed with the egg, and they are fertilized inside the lab. And once the embryo start forming, they are put back into the uterus of the patient. So this is basically a procedure which is now very well established. Initially, it was introduced for people who are having problem in their tube. That is called tubal factor infertility, where your egg cannot travel from the ovary to the tube and to the uterus. So whenever you are having a problem of the tube and it is not functioning, either it is blocked or something like that, then you are advised in vitro fertilization. So it is not related to your age or anything. If you are having a problem in your tube, so whether you are recently married or you have been trying for a longer time, in vitro fertilization is the right choice for you, because there is no other treatment which can provide you a good success rate. Though before in vitro fertilization, we used to offer tubal corrective surgeries. But if you are having a irreparable damage in the tube, then in vitro fertilization becomes a first choice and first treatment which will be offered to you. So whether you are young or old, it doesn't matter. And if you are young, then certainly your eggs are of good quality. And if you undergo in vitro fertilization procedure, then you can achieve a pregnancy very fast. So when your doctor is referring you to an in vitro fertilization specialist, you have to ask what is the problem. If you are having a problem in your tube, then in vitro fertilization becomes the first treatment for you. Another indication where you will be told to go for in vitro fertilization in early investigation period or early treatment period is when you are having uh, male factor. Male factor means when your husband's sperms, they are either very few, they are not of good quality, they are severe male factor. Like normally in husband semen, the normal count and motility is 20 million sperms, more than 20 million sperms, and approximately 40% should be good motile sperms. So when you are having a semen sample uh, in your husband, which is having only very few sperms, then again these sperms they cannot travel uh, uh, to the tube and cannot fertilize the egg. So in these patients, if we offer any other treatment, then it doesn't work. There are very few patients who will be benefited by any medication, and these are very selected patients. So if you are having a problem where your sperms are not good, very few sperms, or for that matter, uh, no sperm in the ejaculate. So when you get your semen test done and there are no sperms in the ejaculate, again you may be advised in vitro fertilization and or other advanced procedure like intracytoplasmic sperm injection, that is called ICSI, and you will require these procedures at the early stage. And as far as the other indications are concerned, whenever you have already tried multiple methods, like you have taken the medication for your egg formation, you have undergone simpler procedure like intrauterine insemination and other thing, and you are not able to conceive, then also you will be advised a procedure of in vitro fertilization. Then another indication which usually is very common, that is if your age is such that you are in entering into the advanced age group, that is beyond 35 or 38 years, when if you have been trying for a longer period, uh, because with the age your fertility declines. So as you are growing older, you are exhausting all your pool of ovary, good quality eggs are declining, and you are having less chances of conception. So again, that is one indication where in vitro fertilization is helpful. Even when you are young and your egg reserve is low, egg reserve is number of eggs available in your body. If they are by various tests on ultrasound, we see that eggs are very few, then usually they are not very good quality, and as the time passes, your chances of conception with other procedures gets diminished. So if you are having a low reserve, low ovarian reserve, that is called low ovarian reserve or poor ovarian reserve, then also you will be advised in vitro fertilization at an earlier stage. And whenever you are advised in vitro fertilization, there are a lot of other questions in your mind. How it will be done, whether it is too painful, or you will have to take extra leave, you will have to lose your job, you have to stay in the bed. These are some of the questions which keep on coming in your mind. Let me tell you very frankly that in vitro fertilization, what we are doing, we are producing multiple eggs by giving you hormone injections. Normally, you produce one egg in a month, but here because we have to use the good quality egg, and it is the procedure which is done outside your body, so we can select good quality eggs and embryo. So we give you multiple injections that is given for 10 days or so, and once your eggs are mature, it is taken out by ultrasound under very minimal anesthesia. So there is no pain as such in the procedure. And once we collect the eggs out, they are taken into a environment which is zero bacteria free, and there is no the temperature is maintained, the humidity is maintained, so you get the best chance of fertilization. Uh, Same day, husband sperm is taken, and they are exposed. They are prepared uh, like good quality sperms. They are taken out by various procedure, and egg is exposed to these sperms. Next day we check fertilization, and once the fertilization occurs, we select good quality embryos on day 3 or day 5, and they are transferred into your uterus. So that is the procedure of in vitro fertilization. There is another procedure which is called intracytoplasmic sperm injection, which gives better fertilization rate, and that is offered usually to elderly people, or where we find that sperm quality is not good. So we can take one good quality sperm, and we can directly enter into the egg and deposit the sperm inside the egg. Once that goes inside, next day we check for fertilization, and once the fertilization occurs, we develop them further in the lab till we get a good quality embryo. And these embryos are selected on its morphological basis, how they are looking, how are the cells, and good quality cells. They are the embryos. They are selected, and usually we transfer 2 to 3 embryos to get maximum success rate. Uh, Now, another condition where the advances have taken place is the male infertility, where your husband is not having any sperm in the ejaculate. And if the sperms are not available, then you don't have many options. So now with the advancement of procedure, we can take out the sperms directly from the testes by various procedures. Uh, and once we get the sperms from the testes, even if they are very few, they can be stored and can be used for uh, uh, ICSI procedure. So these are some of the advances which can really offer you the parenthood with your own sperms, with your own egg. Another concern which is related, always related to in vitro fertilization, is how much bed rest is required. Now, as far as the bed rest is concerned, as I told you, this is a very simple procedure. There is no hospitalization required. And once the embryos are back into the uterus, you can continue doing your normal duty. You need not to disturb your daily routine. There is not much restriction which is advised during or after this procedure. So that is again a myth that all after in vitro fertilization you will require a complete bed rest. Another question which is always asked by most of the patients, and that is relevant also, because when you are undergoing for a procedure, you will always have in mind that it will be successful. So this question is always asked to us, that how much is the guarantee or how much is the success. Now, guarantee or success is actually uh, they are not relevant to this procedure, because nobody can guarantee you a pregnancy. What we are doing in vitro fertilization or intracytoplasmic sperm injection is we are overcoming the defect which your body is not able to carry on, the normal procedure. Now, rest of the things, the development of the body, the fetus, implantation, and continuation of pregnancy is by normal way. So, when we talk of success, it always depends on so many factors. Like as I have told you, as you grow older, your chances of conception becomes low. The same is true in vitro fertilization. So if your age is less, like if it is less than 35, if you are young, less than 30, you have a better chance of the same procedure. If you are getting older, then your chances are decreased. So your success rate depends on your age, what we are getting from your body. If we are getting a good quality egg as you are young, then you can get a better success rate. So it is always related to your age. Second thing, what are the problems which you are having? Like if you are having a disease called endometriosis. Now, endometriosis is affecting your egg quality, your implantation process. So when we are dealing with the patients who are having endometriosis, even at younger age, the chances are little lower than other patients. So it depends on what problem you are having. So when we talk of success rate, it is not like 50% or 60%. Cannot be like that. It is just the probability in your case. So that we need to understand. Like if you are having a good quality egg, a good endometrium. Endometrium is actually the inner lining where your embryo is going to be implanted. So if you are having a good quality egg, good endometrium, there is no major issue with the sperms. Only your tubes are blocked. Then you are having a better chance of conception with in vitro fertilization. If you are older, even if your tubes are patent, hardly they interfere with your conception in vitro fertilization. So if you are getting older, then your chances will be slightly lower. Same is when you are having a defective endometrium because of some disease, because of some infection, your endometrium, that is called soil, which is not very good. So in spite of having a good quality embryo, you may not get a better chance. So success rate always depends on what is available in your body, and accordingly we try to correct the defect and try to give you a success rate which is acceptable. Now all patients will not conceive in one cycle. Again, that you have to understand, because whatever we do, there are few things, like once we put the embryo back into the uterus, they have to survive inside the uterus for some time. Then there is the process of implantation. So they get attached to the uterine lining, and then they start growing. And this all is done inside the body, and we usually do not have any control over it. So depending on the survival of the embryo and implantation, your success rate will come. And then there is another factor which is called genetic factor. So when the embryo starts growing, there is the division of cells, and the genetic factor comes into play. So all these things, they are usually non-modifiable, and that's why all patients do not get pregnancy in first cycle. But if you are having usable eggs, usable sperms, and usable endometrium, then there are very high chances that on repetition of the procedure, you will get a cumulative pregnancy rate, which is quite acceptable in the given circumstances. And usually these conception rate are much higher than your normal conception. Like normal fecundity or normal conception in one cycle at particular age, suppose if it is 15 to 20%, then with in vitro fertilization you can get a chance which is approximately 45-50% or 55%, depending on your condition. Another important question is of the cost. Now, this is always asked that how much is the cost of the procedure, uh, and how it is related to your procedure. So, depending on the procedure in India, cost much less than the other parts of the globe. Like if you compare the cycle cost uh, in India, in Delhi, it is almost 30% of the cost, which is actually at the developed countries. So depending on the problem, like whatever procedure we are offering, uh, the cost effectiveness is always there when it comes to the in India. So of course, the cost may be variable depending on the various procedures which are being offered to you. Even if you are not having eggs in your body, then we do offer egg donation program. So where the eggs can be borrowed from some donor, and the rest of the things like husband sperms are available, your endometrium is available, so you can proceed ahead in the program. Uh, as far as the duration of stay is concerned in India, once you plan your procedure, usually it is 3 weeks. At least 3 weeks you have to be in India for a single cycle. So usually what we do, we always communicate with the patient who are overseas. They can uh, contact us on uh, mail, or they can do the video conferencing before planning, before coming to India, and that minimizes the uh, duration of stay in India. Uh, Usually, we ask all your reports, older reports, to be sent on mail, and once we go through the reports, we can counsel you better on video conferencing. So that is how we can reduce your stay in India. Uh, as far as the other problems are concerned, which are usually associated with infertility, uh, they can be uh, uh, they can be actually investigated before we go for in vitro fertilization. Uh, there is a question from Mr. Aryan Raj. He is asking, like, uh, they are having one child and they want to go for another child, and wife is not conceiving. So we need to undergo by do certain tests and to find out what is the problem. And certainly, in vitro fertilization is one procedure which usually is applicable to almost 95% of the patients. So, if on investigation, if you are having a reserve which can be used for your in vitro fertilization procedure, if you are having a sperm, even if you are not having a sperm, as I have told you, we can extract the sperms from the testes and can be used. So certainly, uh, in vitro fertilization is one procedure which can give you a pregnancy. I request all patients who are suffering from these problems, they can get in contact with me and I will try to help them out. If the IVF is not successful in first time, uh, you have to go for a second cycle or third cycle, but it is not necessary that you cannot get a pregnancy in first cycle. As I have told you, many patients, like depending on the age, more than 50% of the patients, they do have a chance of conception in first cycle itself. So it is not like you cannot conceive in first cycle. Uh, it depends on your egg quality and your receptivity. So as far as the conception rate in first cycle is concerned, it is usually between 45 to 50% depending on your problem. So you always stand a chance of getting a pregnancy in first cycle itself. And many of the patients do conceive in first cycle. Only those patients who are not getting the pregnancy in first cycle, of course, they will need to go for a second cycle and third cycle. For more information, you can log on to my website, that is www.kjivf.com. I will again repeat, it is www.kjivf.com. You can write to me on my email, that is info.kjivf@gmail.com. I will again repeat, it is info.kjivf@gmail.com. The I am available at Delhi Clinic, that is KJIVF and Laparoscopy Center, 24 Gagan Vihar, Delhi. You can reach to us through email, through SMS, through my website, and all details they are available on my website. Uh, you can reach to us through mail or through website. If there are any questions or any other thing, I will be happy to solve your problems. Uh, During this difficult Corona time, I wish all of you a healthy future, and be safe, stay inside, and take care. So this is all for today's discussion. I again repeat my email, that is info.kjivf.gmail@gmail.com. You can post your queries to us and I will try to help solve your problems. Thank you. Have a good night. Uh, that is all for today. We will be seeing you again sometime in future. Thank you so much.